What if I told you that the tingling, burning, and numbness you've been feeling in your hands and feet, the kind that wakes you up at night, that makes every step feel uncertain, isn't necessarily permanent? What if decades of medical assumption have been wrong, and that a single vitamin, one that most people over 60 are severely deficient in, has the documented power to begin reversing nerve damage in as little as 14 days? I know that sounds bold. I know it sounds almost too good to be true, but stay with me, because what you're about to learn in the next 20 minutes could genuinely change the quality of your life, and the science behind it is more solid than most people realize. We're talking about nerve damage, medically known as peripheral neuropathy, and we are talking about vitamin B12. Not just any B vitamin, but specifically B12, and more importantly, the right form of B12, taken the right way, at the right dose. Because here's the thing, most doctors do check B12 levels, but the standard reference ranges used in conventional labs are wildly outdated, and millions of seniors are walking around being told their B12 is fine, while their nerves are quietly deteriorating month after month. By the end of this video, you'll understand exactly why that happens, what to do about it, and the specific form of B12 that clinical studies have shown can actually help repair damaged nerve tissue, not just slow the damage down. Let's start by understanding what's actually happening inside your body when nerve damage occurs. Your peripheral nervous system is made up of billions of nerve fibers that carry signals from your brain and spinal cord out to every part of your body. Your fingers, your toes, your legs, your organs. These nerves are wrapped in a protective coating called the myelin sheath. Think of it like the rubber insulation around an electrical wire. When that insulation is intact, signals travel cleanly and quickly. When it breaks down, and this is exactly what happens in neuropathy, the signals become disrupted. They misfire, they weaken, and sometimes they don't get through at all. That's where the burning sensation comes from. That's where the numbness comes from. That's where the feeling of walking on pebbles or wearing invisible gloves comes from. Now here is where vitamin B12 becomes absolutely critical. B12 is the only vitamin in the human body that is directly involved in the synthesis and maintenance of myelin. Without adequate B12, your body literally cannot rebuild that protective sheath around your nerves. And this is not a minor inconvenience for your body. It is a catastrophic supply chain failure for your nervous system. When B12 is chronically low, the myelin breaks down faster than the body can repair it. Over time, the nerve fibers themselves begin to degenerate. This process is slow, silent, and almost universally misattributed to aging. And here's the part that most people don't hear from their doctors. After the age of 60, your body's ability to absorb B12 from food drops dramatically. This happens for a very specific reason. To absorb B12 from food, your stomach needs to produce something called intrinsic factor, a specialized protein that binds to B12 and escorts it into your bloodstream. But as we age, the cells in the stomach lining that produce intrinsic factor gradually decline. Some people stop producing it almost entirely. This condition is called atrophic gastritis, and studies suggest that anywhere from 10 to 30% of adults over 60 have it to some degree, most without ever knowing it. This means that even if you eat plenty of meat, eggs, and dairy, all rich sources of B12, your body may not be absorbing more than a fraction of what you consume. Add to that the widespread use of certain medications, and you have a perfect storm for B12 deficiency in older adults. Metformin, the most commonly prescribed diabetes drug in the world, is one of the worst offenders. Studies have shown that long-term metformin use reduces B12 absorption by interfering with the calcium-dependent mechanisms in the gut. Proton pump inhibitors, medications like omeprazole and pantoprazole used for acid reflux, reduce stomach acid, which is needed to release B12 from food proteins in the first place. H2 blockers have a similar effect. And because so many people over 60 are taking one or more of these medications, the risk compounds with every passing year. Now back to that issue with lab ranges. Standard laboratory reference ranges for B12 in most countries consider anything above 200 picograms per milliliter to be normal. But here is the critical gap in that definition. Neurological symptoms of B12 deficiency have been documented in patients with levels between 200 and 400 picograms per milliliter, levels that would pass any standard blood test as acceptable. Research published in journals including the New England Journal of Medicine has shown that serum B12 is actually a poor marker for functional B12 status in the body. A more accurate test is something called methylmalonic acid, or MMA, and homocysteine. When B12 is functionally low, even when serum levels look okay, both MMA and homocysteine rise in the blood. If your doctor has only checked a standard B12 level and told you it's fine, it's worth asking specifically for these additional markers, especially if you're experiencing any neurological symptoms. Now let's talk about the evidence that B12 can actually reverse nerve damage, because this is where it gets genuinely exciting. There is a specific form of B12 called methylcobalamin. Most supplements on the market contain cyanocobalamin, which is a synthetic form that the body must convert before it can use. Methylcobalamin, on the other hand, is the biologically active form. It is the form your nervous system uses directly, and the distinction matters enormously, particularly for nerve repair. Multiple clinical studies conducted primarily in Japan, where methylcobalamin has been used as a pharmaceutical treatment for neuropathy since the 1980s, have shown that high-dose methylcobalamin not only halts nerve damage but actively promotes nerve regeneration. One landmark study showed measurable improvements in nerve conduction velocity, essentially how fast electrical signals travel through nerves, after just 2 weeks of treatment. That is where the 14-day claim in the title comes from, and it is grounded in published clinical research, not anecdote. Methylcobalamin works for nerve regeneration through several mechanisms. First, it directly supports the production of myelin by contributing to the synthesis of methionine, a precursor to S-adenosylmethionine, or SAM, which is the methyl donor used in building myelin sheaths. Second, methylcobalamin has been shown to accelerate the regeneration of damaged axons, the long projections of nerve cells that actually transmit signals. Third, it exerts a neuroprotective effect by reducing the accumulation of homocysteine, which is itself neurotoxic at elevated levels. So you're getting a compound that repairs existing damage, protects against future damage, and removes a chemical that actively harms nerves, all in one molecule. The doses used in those clinical studies were considerably higher than what you'll find in a standard over-the-counter B12 supplement. Most commercial B12 vitamins contain between 500 and 1,000 micrograms. The studies showing nerve regeneration use doses of 1,500 to 6,000 micrograms per day of methylcobalamin specifically, often divided into 3 doses. This is far above the recommended daily intake, but it is important to understand that B12 is water soluble, which means excess amounts are excreted through the urine rather than accumulating in fat tissue the way fat-soluble vitamins do. Toxicity from high-dose B12 is extraordinarily rare. However, and this is critical, you should always discuss dosage with your doctor before making significant changes, especially if you have kidney disease or are on blood thinners. There is also an important point to make about delivery method. Because many older adults have reduced stomach acid and declining intrinsic factor, swallowing a standard oral tablet may not result in significant absorption. There are 2 ways to work around this. The first is to use a sublingual form of methylcobalamin, tablets or liquid drops that you place under your tongue and allow to dissolve. The tissue under the tongue is highly vascularized, meaning B12 can be absorbed directly into the bloodstream without needing to pass through the digestive system at all. The second option, often used in clinical settings, is B12 injections, which bypass digestion entirely. If your deficiency is severe, your doctor may recommend a course of injections to rapidly restore your levels before transitioning to sublingual maintenance doses. Beyond B12, it would be incomplete to talk about nerve health without mentioning the nutrients that work synergistically alongside it. Alpha-lipoic acid is a powerful antioxidant that has been studied extensively for diabetic neuropathy and has shown benefits for reducing pain, burning, and numbness in damaged nerves. Benfotiamine, a fat-soluble form of vitamin B1, crosses the blood-brain barrier more efficiently than standard thiamine and supports nerve energy metabolism. Vitamin D deficiency, also extremely common in adults over 60, has been independently linked to increased neuropathy risk and nerve pain. And magnesium plays a critical role in nerve signal transmission. Deficiency can mimic or worsen neuropathic symptoms. These are not replacements for methylcobalamin, but they are important cofactors that can significantly amplify the results you see. There are also lifestyle factors that either accelerate nerve damage or support recovery that must be addressed honestly. Alcohol, even in moderate amounts, is directly neurotoxic and dramatically worsens neuropathy. If you're dealing with nerve damage and consuming alcohol regularly, that is the single most impactful behavioral change you can make. Blood sugar management is equally important. Chronically elevated blood sugar damages the capillaries that supply nerves with oxygen and nutrients, compounding whatever nutritional deficiency may be present. Even in people who are not diabetic, post-meal blood sugar spikes, the kind that come from refined carbohydrates and sugary foods, can cause cumulative microvascular damage over years and decades. Sleep is another underappreciated factor. Nerve repair happens during deep sleep, when the body releases growth hormone and conducts the most significant cellular maintenance operations. Consistently poor sleep significantly slows recovery. Exercise, specifically the kind that improves circulation, is one of the most evidence-supported interventions for peripheral neuropathy that has nothing to do with pills or supplements. Walking 20 to 30 minutes daily improves blood flow to the peripheral nerves, has been shown to stimulate nerve fiber regeneration in the skin, and reduces neuropathic pain. Even gentle resistance training builds the muscle strength that compensates for the impaired balance and coordination that comes with nerve damage, reducing fall risk, which is a major concern for seniors with neuropathy. One thing I want to address directly is the emotional component of living with nerve damage, because it's rarely acknowledged in medical conversations. Chronic pain and sensory disruption are exhausting. They affect sleep, they affect mood, they affect your willingness to stay active, and they can create a cycle of decline that is very difficult to reverse once it gains momentum. If you've been told there is nothing that can be done, that it's just aging, that you have to manage it, I want you to understand that the medical conversation around peripheral neuropathy has genuinely evolved. Neuroplasticity, the brain's capacity to adapt and rewire, and the nerve's own regenerative capacity are both far greater than was believed even 20 years ago. The right nutritional support, delivered consistently at therapeutic doses, gives your body the raw materials to take advantage of that capacity. So let me bring this together for you clearly. If you are over 60 and experiencing tingling, numbness, burning, or weakness in your extremities, the very first step is to get a thorough evaluation that includes not just serum B12, but methylmalonic acid and homocysteine levels. Ask your doctor specifically about these tests. If you're on Metformin or proton pump inhibitors, have an honest conversation about monitoring your B12 status more aggressively. If supplementing, choose methylcobalamin over cyanocobalamin, use a sublingual delivery form to maximize absorption, and discuss therapeutic dosing with your healthcare provider. Support your B12 with alpha-lipoic acid, vitamin D, and magnesium. Reduce alcohol, manage blood sugar, prioritize sleep, and incorporate daily gentle movement. None of this requires expensive interventions. Much of it you can begin this week. The nervous system is more resilient than you've been led to believe. The research is clear. With the right nutritional support, nerve repair is not just possible, It is measurable, and for many people, it begins within 2 weeks. Your body wants to heal. It simply needs the right materials to do the job. If you found this information valuable, please make sure to subscribe to the channel so you never miss a video like this one. Give it a like to help more seniors find this information, and drop a comment below letting me know what health topic you want us to cover next, because your questions genuinely shape what we create for you.